1, start.
Hello friends, we are going to discuss some projections based on the available COVID-19 data for India and Maharashtra. As on today, which is 20th of April 2020, frankly, we decided to make this video purely out of our love of data. To start with, we are not going to introduce ourselves as such. Don't worry, we are not hiding ourselves or our identities as such. Obviously, you can see our faces, you can hear us, you can probably, you reached here on this video based on our social media handles, and you surely can find us anyways. So both of us love data, and of course, playing with the numbers is our kind of part-time hobby. We had a kind of an academic and a political sort of discussion in our individual capacities. And through this video, we are planning to share this discussion with all of you. So this is primarily not about us or who we are or the kind of positions we are holding. So we discussed over some kind of calls and strictly sticking to the social distancing norms, we created this video sitting in our own homes. Let me start with a kind of a disclaimer. This is purely an academic discussion. We are not trying to influence any people. We are not trying to tell people what to do or what not to do. We are not trying to tell the government or anybody else what should they be doing or not. We are not trying to defame anybody or no other political reasons for sure of whatsoever kind.
Yeah, anything else?
Okay, so let's start.
Sure. So, yeah, so before I get into a long winding discussion, I wanted to start with a TLDR.
What is TLDR? You researchers are really fond of using these crazy abbreviations.
Yeah, well, this one is a simple one. It says too long and didn't read or too long and didn't see video. Then, the next few minutes will just give you a summary of what we are going to discuss and present. So most of the discussion is going to be about, how we did it and what might be interesting about it and so on. But here are the results. Okay. So today is 20th of April, 2020. And in the morning at 8 o'clock is what this analysis kind of represents the data of. So based on the data so far, the COVID-19 cases that we are projecting are about 30,000 between 27th April to 4th of May, about 40,000 between say 7th or 8th of April to maybe 13th or 14th of May. Sorry, 7th or 8th of May to 13th or 14th of May, and about 60.
Possible to point to the graph so that
yeah. Okay, so that's 30,000 line if you see on the x-axis, and these are the dates. So around 27th of May to 4th of May, we will probably have 30,000 somewhere between those dates cases, and then between 7th or 8th of May to maybe 12th or 15th of May, we will have 40,000 cases. And then sometime after 15th of May is till probably a fairly long time into the future, maybe sometime in June, somewhere between that time period, we'll probably hit 65,000. It really depends on how data moves from here. So that's as far as cases is concerned. Actually, cases can vary a lot based on testing and so on. So the number of deaths is a more reliable figure, is what a lot of people believe. So today morning, April 20th, 8 a.m., we kind of just crossed about 500 deaths in India. And based on the data so far, we can project that about 1,000 deaths is what we might reach, but not before 27th of April, and probably maybe around 5th May or so. So in that range, so between 27th of April to 5th of May, sometime between that line, we might cross 1,000 deaths in India. And 2,000 deaths actually is a little difficult to predict at this stage. So maybe around 28th of May is when we have the first likely point where we might reach 2,000 deaths. Most probably it will be much more into the future, if at all. And what we should really hope for is that we should not reach 2,000 deaths. It looks like 1,000 deaths might happen, but hopefully we will not reach 2,000 deaths anytime in the future.
Oh, so those are some numbers. At this moment, at least, looks like just some numbers. But I'm sure in the next 10-20 minutes, we'll be decoding how did you come over here. Let's start with where did you get all this data to make this analysis?
Right. So there are a lot of sources, and many people must be following a lot of sources available. But the prediction that I have made, projection that I have made, is basically based on the official data released by the Ministry of Health and Family Welfare website every day. So every day in the morning and evening, I go on their website and capture what are the numbers. So these are the numbers as of this morning, 20th of April. So they are telling that there are about 14,000 active cases, 2,000 cured or discharged cases, 543 deaths, and 1 migrated. So that's the data coming from the MOH website.
Oh, interesting. So a couple of days back, few data scientists came up with some kind of projections, and they also talked about few numbers. I remember we discussing about the Times Now report.
Yeah.
I mean, that was one way of predicting and projecting some numbers. I'm sure you have come up with your own methodology, data model, and tell us more about both, frankly. One is the Times fact and your analysis.
Yeah, so the Times fact analysis actually analyzed 5 different models and they took an average of that. And then they are projecting that based on that average, they are predicting these red dots. Okay. Frankly, I think they are a little bit of overestimates. My own estimates are a little smaller. So I believe whatever they are showing as red dots, I believe those will be achieved a little later. For example, they are projecting that by about 14th of May, India would have had 65,000 cases. I believe the earliest that will happen is 15th of May. And actually, it looks like it might happen much later, somewhere around towards the end of May or maybe even in June. So my numbers are a little bit more optimistic than were presented by Times Fact. Those who want to know more about it, information about that is available. They in fact have it posted on the YouTube. So if you search for Times Fact India Outbreak Report on Coronavirus and COVID-19, this was aired by them 3 days ago on their TV channel, and the people have been viewing that. And these are the different, like they're comparing the Italian model, the American model, and then they have 3-4 different scientific models that they had, that different experts had predicted. And the average prediction is like this. So for example, on 22nd of May, they were projecting 76,000 models. So that's the number there. I believe we probably wouldn't, or maybe just be reaching 65,000 around that time, if at all, at the moment, according to my projection. Of course, all of these are projections. They can change based on how things go. So that's the source of data. Yeah.
Wonderful. Let's get back a little closer to our house, which is Maharashtra. Do you have some specific numbers for Maharashtra?
Yeah, of course I have. Again, here the red dots are the projections by the Times Fact people. So the blue lines show the known cases again till this morning. My own projection is that we might reach 5,000 cases, maybe by sometime later in this week. We currently are a little above 4,000. So we should be reaching 5,000 cases maybe by Wednesday or Thursday this week. By towards the end of next week, maybe on the 1st of May, 2nd of May, and possibly no later than 6th or 7th of May is when we will reach 1,000 cases. That is what even the Times Fact report is projecting. About 9,000 odd cases on 3rd of May is what they are projecting. They are projecting about 14,000 odd cases or 16,000 odd cases on May 14th. That might work out, but I am really hopeful, and I believe that we will probably reach around this 25,000 number. We could, currently the projections look because quite steep, because yesterday, if you remember, there was a big spike, and that has pulled this blue line a little sooner. This 25,000 line. Earlier, it was showing to start around towards the end of May, but it looks like it could start as early as 11th of May. But all along, it was actually showing that it will probably start in the first week of June, the second week of June, and so on. So this average will be somewhat later. The earliest it could start is 11th of May. But I'm really hopeful that it will happen much later, because this is just the last spurt. This is what I'm hoping. This is the last spurt of cases that Maharashtra is finding. In
So
terms of the
let me decode this graph for myself. The range you are showing is like the 14th of June will reach about 25,000 in Maharashtra.
Maharashtra, yes. So actually, the best thing to look at is 10,000.
Mm-hmm.
So anytime between 1st May to 6th May, we could reach 10,000 cases in Maharashtra.
Okay.
Okay,
Okay.
that's a more reliable range.
Mm-hmm.
25,000 is a far out range. A lot can change by the time we reach there. Maybe we
Mm-hmm.
will not get 25,000 cases. Might be this blue curve will go like this and then stop going ahead. Okay,
Mm-hmm.
or maybe it will go very slowly and then much later it will reach 25,000. Any of that can happen, and
Mm-hmm.
that's what this wide blue line represents actually. So in fact, it is not ending on 21st of June. This last number you see is 21st of June, and in fact
Mm-hmm.
it will probably go towards end of June. So right now there is a lot of uncertainty from 11th of May to end of June. We can reach 25,000 at any time, or maybe it might happen. I mean, one reason why this uncertainty might be there is because some of the models are projecting that we may never reach 25,000 in Maharashtra,
Oh,
and then
oh.
some models are projecting that we will reach in this particular range. So it depends on which model you use. It is
Mm-hmm.
too early to predict about 25,000 in Maharashtra, is what I believe.
Oh. How does
Okay.
the fatalities data looking like for Maharashtra?
Yeah, so Maharashtra fatality is actually looking better recently than earlier.
Mm-hmm.
So as of now, again, we recently crossed 200 deaths in Maharashtra.
Mm-hmm.
Uh, Only day before yesterday. Today morning, I believe, is 223
Mm-hmm.
deaths so far. And I believe that this number could hit around 400 towards say 27th or 28th of April,
Okay.
and maybe uh, by definitely by 5th or 6th of May. So between 28th of April to 6th of May, we will sometime hit the number 400, hopefully later
Mm-hmm.
than sooner. Uh, and then there is again a big uncertainty about when will that double from there. So for example, when might we reach 800 deaths? So one possibility, the earliest possibility it seems like is 11th of May, but
Mm-hmm.
again there is a huge uncertainty and it goes all the way into end of June, where we could actually also hit. So
Mm-hmm.
if you see this curve in more recent times, it has slowed down. So if it continues to slow
Mm-hmm.
down, we may never hit 800 also. Again, some models are showing that we may never hit 800. In
So,
fact, some models till
if
yesterday
I
were showing
read,
that we may never hit even 400.
so if I read this graph rightly, are you trying to say that we Maharashtra may not even cross 800 fatalities?
As of now, there are different models which have different projections. So some
Mm-hmm.
models project that we might reach between 11th of May towards maybe towards the end of June. That's like a very wide projection, range of dates within which we might cross 800 deaths.
Okay.
Uh, some models are showing that we may never reach 800. Okay,
Okay.
so let's hope for that, and it's a long time ahead. It's almost 2 months ahead that we're trying to project. It's very difficult with COVID data to project 2 months ahead what might happen. It's really a tough thing. But that is a good news. That means there is a lot of uncertainty, but at least the bad news is not certain. That's what we would like to look at.
That's very interesting. Hey, by the way, one more question in my mind for a while was, how are we doing on the testing? So, is there a relation between how much should we be testing and any thoughts about that?
Right. So here is an interesting graphic that I put together, a graph. So this graph needs a little bit of explaining. So let me do that first. So on the x-axis here, we
Mm-hmm.
have the number of tests the country needs to do to find one positive case.
Mm-hmm.
Okay. So like if you take an example of a country, let's take a country in the middle. The Thailand is over here where I'm pointing. Probably the text is so small, but where I'm pointing over here,
Yeah, we can see
that
your.
is where Thailand is. Okay,
Mhm.
so Thailand is doing about 37 tests before it finds one positive
Okay.
case. Okay,
Okay.
so that's the x-axis. On the y-axis, we have fatalities per 100 cases. So percentage of
Okay.
fatalities. So how many
Okay.
people who are found to be positive
Mhm.
uh, eventually go and die, basically. Okay, so now we continue with the example of Thailand. So Thailand has about 2 fatalities per 100 cases. So,
Mhm.
or a little less than 2, I think 1.8 or 1.6 or something. So, so they are the fatality rate. Okay. So now the way to interpret this graph is the countries on the far right over here. There is South Korea here, Lithuania, Russia, Australia, Kazakhstan, and so on. So these countries are probably testing, I would say, too much or way more. Like they are, so South Korea needs to test 53 different people before it can find one person who is positive right now. So that's been their average so far. Okay. So the reason why I say too much, everybody should be tested in the world. There is no doubt about it. But right now, there seems to be all over the world a bit of a shortage of test kits. So if these countries are buying out to all the test kits in the world, or too many test kits for their people, and relatively speaking, their fatality rate is fairly low. You can see all these countries are on the lower end of the fatality rate. Then probably some of the other countries need to test more. So if you look at the other end, so like for example, France is over here. Okay. So their tests per positive case is 2, which means that every 2 tests that they conduct tests on 2 people, one of them is likely to be positive. Okay, so that means there are a lot more people in France who might be positive than they know as of now. So they need to be able to test a lot more people, asymptomatic people and other groups of people who are actually not or maybe even symptomatic people with even mild symptoms, they are not able to test because of the rationing of test kits. I don't know what the ground reality is. So this is just looking at the numbers. I have not visited anywhere. We've been in a lockdown for almost 4.5 weeks now. And so we are just looking at this from this point of view. So that's the two axes.
Observation here is the people on the left-hand side top probably should be testing more, and the people on the right-hand side bottom are probably testing more than what they require. Is that a general understanding? Is that right?
That is correct. Absolutely correct. So if you take France, I'll explain. So if you look at France on the left, or UK is over here, or Italy is over here. So they are actually, finding cases quickly. They do a few tests, and one or two, or one of them has. So France, every other test. Italy, every 7th test is positive. Okay, that means in their population there is a large number of hidden HIV, COVID positive people. Okay, and so they need to be able to test them and isolate them and quarantine them and so on. And then as they do that, as they test more, they will slide down this blue line, and they will come more in range over here. So what that means is that so actually the actual fatality rate, unless the health system is overwhelmed, their actual fatality rate will not change much. Okay, what will change is that they will isolate the people whom they can identify to be positive, and those people can take more care and maybe stay at home or stay in only one room, not go out, not infect their family members. The family members stay away from them for a few days so that they don't get infected. So we then stop the spread of the virus more easily if they are able to test more. So that is what will happen. So the effect will, the statistical effect will be their number will come down. Their number of cases will go up. The number of deaths per case will go down. Okay, but that is just a statistical thing. Those people are probably asymptomatic and sitting in a lockdown at home perhaps, but they will take more care and they will stop spreading the disease. So that is the main benefit that will happen if that was to come out.
Hey, every chart and data kind of tells a story. Algeria looks like a horror story. Almost every person they're testing is
turning out to be positive.
I didn't understand that number.
So again, I believe, again, I haven't been to Algeria. I don't know people in Algeria, but probably Algeria is run out of test kits. So it is rationing their test kits a lot. So the number that they know of people who are COVID positive is very much more in reality than what they've actually found out so far. Okay. So, and about 16% of the people who are COVID positive have died, which means that it can mean 2 things: that they have a very high fatality rate, and that could happen if their healthcare system is overwhelmed, or what seems more likely is they don't have enough test kits, so they haven't tested enough people so far. And so once they test more people will turn out to be positive, and that will sort of bring down their apparent test rate. So they will move down and to the right.
So one more interesting country you told me about is, I believe, UAE, which is exactly opposite of Algeria, maybe. Can you tell us?
So UAE is actually not on this anywhere. So if you can read this graph, You will probably not find UAE, because UAE has to test 130 people before they can locate one positive person. So they are out of this chart literally. And if you have to put UAE on the chart, then you will probably not be able to see any of the countries, or because they will all be in one half of the screen basically. So you can see only 60. So you have to have one more screen, and then UAE will be after that. Okay, so UAE is testing way too much at the other end of the scale. So you ask about India. So India is actually sort of here right in the middle, and it seems to be actually testing pretty well. I mean, India has to test about 23 people before it finds one positive. That's the current testing rate. And it seems to have a reasonably low fatality rate also per 100. Okay. So it is about, I think, about 3.5 or so. So below 5, and fairly near that blue line. So
hey,
this
by the
blue
way, this
line.
graph. Yeah,
Right.
exactly. I was just about to ask you about the blue line. This really looks interesting.
Yeah, so the blue line is basically what is called as a trend line by statistician. So each of these dots represents a country, and the blue line represents the overall trend of this. And associated with that blue line is what is called as an R square number. So if you see over here, the R square number is about 0.39. What that means is that the metric tests per positive, the x-axis, explains about 39% of change in fatalities per 100 cases, which is y-axis. So that's what it means in statistical terms. So the more you are to the right, or where you stand on the x-axis, determines where you will be on the y-axis 39% of the times, or 39% of the cases. And then on top of that, there is remaining 61% variation that is happening because of other factors, so which are not accounted for. But this accounts for about 39% of the variation, where you will find. And in fact, the other thing that I wanted to say was that the test per positive case is actually a metric that I invented. I talked to a few epidemiologists, and actually I must say that I am not an epidemiologist, neither are you. But we must acknowledge that epidemiologists normally do not use this metric. They prefer some other metrics. Actually, they look for prevalence. They look for the incidence rate in the population in normal conditions and in normal diseases. So the thing that happens in normal conditions is that you have enough test kits and you have had enough time and so on. The problem with COVID is that it has risen so fast in the world that the world hasn't had the opportunity to manufacture enough test kits and go and test enough people. So the true prevalence in each country will not be known for a very long time in COVID, until we have enough testing and we have really made the tests much cheaper than they are right now, and all of those things happen. We are not really going to manage to know the actual prevalence in the world. So when we know that, then epidemiologists will then be able to tell the true fatality rates and so on. So what we are looking at, what in fact we should be calling this y-axis, is apparent fatality rates rather than real fatality rates. Okay. And then eventually what might turn out is that test per positive has no correlation with the true fatality rates. That is because all these people over here who are having high fatality rates on the top would have slide down the blue line, and would have randomly distributed between under 5% from 10 to 600 or whatever the number is. So it will become completely uncorrelated, non-correlated with the x-axis. But right now, until we reach such a stage where we can test everybody and test extensively, this is giving us a hint of what is happening out there. Okay.
Understood. Hey, by the way, India is a very huge country, and is it really possible to put the India into a single dot? What came to my mind. Is there a state-wise analysis or something like that?
Yeah, so the state-wise analysis is available. In fact, I did statewide analysis. Before I kind of talk about this a little bit more, though, I must say that state level data fluctuates a lot more because states are much smaller than the country. Country level data is a lot more stable. State-wise data might change from day to day. So this is state-wise data from 19th of April, which is from yesterday. Incidentally, this picture I had created on 17th of April. So some of the countries might have also moved from their places I have shown over here. So this is like from 3 days ago, and the statewide data is from yesterday. So if you see, Delhi is over here, West Bengal. So by and large, on the right, let us start with Karnataka, Kerala, Haryana, Andhra Pradesh are doing more than 40 tests uh, per 40 tests before they can find one particular positive. On the left hand side, we have Maharashtra, Madhya Pradesh, West Bengal, Delhi, and Gujarat. You can see they're slightly also above that blue line on an above average fatality rate or apparent fatality rate, as we were calling it. And in the middle are Punjab, Jammu and Kashmir, Tamil Nadu, Uttar Pradesh, Rajasthan. They are between 20 to 35. That seems to be the median good range. And they are fine. Punjab also seems to be having a slightly above average. So it kind of seems to be far away from the trend line. So it is in a sense beating the trend and going far away.
Does that mean Maharashtra and Punjab should do more testing or something?
Yeah, well, this is, I mean, again, let me repeat, I'm not an epidemiologist or I'm not an expert in this area. I'm just looking at the numbers, what they're telling. This is for the epidemiologists and the experts in the healthcare departments of various state governments and the central government to sort of really decide. I'm just presenting the data that I found, and I didn't find anywhere else on the internet, so probably other people have missed it. So that is the purpose of my sharing this. So yeah, so it looks like, from the numbers, it looks like, so by the way, let me emphasize here, Maharashtra has done extensive, I think today, as of today, there are more than 70,000 tests, and India has done more than 4 lakh tests, okay? And so Maharashtra has the largest share of tests in the country among the states. But even so, it seems to be having a higher fatality rate. And the implication of that perhaps is that there are some people hidden who have not yet been found out to be positive. Because we shouldn't be having such a high fatality rate in a state like Maharashtra. Although there is a lot of pressure on the healthcare system, I don't think the healthcare system is overwhelmed as yet, even in Maharashtra. So it seems to be still holding up, and the medical people are actually putting in huge amount of effort so far. But they have not yet broken down or given up or anything like that so far. So they are still managing their patients well. So considering that, they shouldn't be having such a high fatality rate. The high fatality rate just indicates that there are some hidden cases out in the society who are probably asymptomatic, and we need to go out and test those people. Okay. And so how to do this now? Again, I'm not an administrator. I do not know what is a good way of doing this and so on. But they must probably find smarter ways of figuring it out. Similarly, Punjab seems to be having a slightly higher fatality rate, which indicates that there may be some hidden causes, or there may be other reasons actually. What they could also do is use this method. I mean, this data is very easy to generate. This graph is very easy to generate. And I don't have data at the city level, or I don't have data at a district level, or I don't have data at maybe even a Kasbah level. They can put data at these levels and see maybe there are specific Kasbahs where they need to pay more attention, or specific districts where they need to pay more attention. And that might show up on a graph like this. Again, as a temporary measure, this is really not the ultra scientific way of doing it, but this is something that they can do.
Okay, this was one very interesting graph. Tests per positive case on x-axis and fatalities per 100 cases on y-axis. It was an amazing data for sure. Hey, by the way, let's get back to the cases in India. I was really wondering, how are you actually predicting? I can plot things on a graph and say, this is what happened in last week, yesterday, today. But how are you able to kind of project it to the future?
Good. So we go back to this graph. So just to remind ourselves, we're predicting 30,000 from 27th of April to 4th of May, and 40,000 somewhere between 5th or 6th of May to maybe 14th or May, 12th, 13th May.
Yeah.
And then we could get to 65,000 as early as 15th of May, but hopefully much later, or probably never at all, or maybe much later in June, or hopefully even in July. So that's the broad prediction that I'm having right now.
Okay, let me repeat that. So you are trying to predict that in India, number of cases may not even cross 70,000.
Yeah, hopefully not. That's the hope. As of now, 100,000 looks we might not cross, and 65,000 we might cross somewhere there. That's what different models are looking. It depends really on which model you're looking at, and that's what I'm going to explain now. Sure. One of the challenges is that models are a little unpredictable. Okay, and let me explain and show by giving an example of just one specific model. So
Mhm.
here is a model. It's called as a polynomial model. So this is the fourth degree polynomial model. Okay,
Mhm.
which is predicting the light blue line that you see. I don't know if you can see that. This is the light blue line that goes
Yeah,
like
the
this.
thin blue
Yeah,
line.
yeah, thin blue line that is projecting. So it is using the data from the past and
Mhm.
projecting the same equation in the future and assuming that it is following that equation. This is where the data might go. This is a
Mhm.
projection. This is not the reality. Okay. The thing about the model is that it is an approximation, and it probably is fairly correct. When people say, our models have an R square of 0.99, what they mean is that it explains the past 99% accurately.
Okay.
However, there is no guarantee that it will explain the future in any level of accuracy. Okay, so this has been a challenge with models.
Mhm.
And this particular model, for example, is showing even more aggressive rise of COVID than the times fact people had predicted. These red dots are what the times fact people had predicted. And the
Mhm.
blue line is showing even more aggressive than that.
Mhm. Mhm.
Okay. But based on even this fairly simple model, we are saying that actually it will not come. And that is because we are modeling the model in some sense. We are doing a meta model of sorts. And I would like to explain. So for that, we have to look at it a little bit historically.
Mhm.
Okay. So March 22 was our Janta curfew day, if you remember. Okay.
Mhm.
So, and this is the graph. This is how this model was looking on March 22. So it was
Okay.
looking much more aggressive than it is even now. Okay.
Mhm.
But by March 31, so it had been about a week of our lockdown.
Mhm.
The and about 2 weeks, I think, or a little bit more than a week of the international travelers coming out. Remember, till March 22, mainly it was international travelers who were getting the
True. True.
coronavirus infections. So that trend had reduced, and the broader trend of people getting infected from clusters had not started yet. So the model changed, and became a lot more conservative. Same model, it was the same equation, the same
Mhm.
model, but now the parameters changed, and now it is showing that okay, India will have a much slower progression.
Oh.
But by 7th of April, the picture had changed for gloomier once again. Then again, the model was becoming much steeper, and it was actually showing much more aggressive rise of coronavirus in the country. Okay,
Mhm.
and so that's the issue. So probably our testing was ramped up. Maybe there were some infectious events that happened in the country. There may be whatever might be the reason. We don't know. We are not looking at the reasons here. We're just looking at the numbers.
True.
But the numbers were showing a very, very poor picture by April 7th.
Mhm.
But by April 12th, the numbers, so you just compare. This was April 7th. By April 12th, the line had moved ahead.
Oh.
Okay. And by today, the line
Mhm.
has moved ahead again. So we can compare again. So you see, this is April
Oh.
7th,
Okay.
this is April 12th,
Mhm.
and this is April 20th, which is today. Okay.
Okay.
So the line had gone ahead. And so we are actually looking at how this line is moving. And we
Mhm.
are creating an interesting graph of our own and trying to project how this line will change and go ahead in future. So if you see, the line is moving ahead. So by the time we go ahead by 1 week, the line would have moved ahead a little bit also, hopefully. Right? So that we are trying to anticipate how the model is changing itself.
Mhm.
That's not something that usually is done. And in a long run, the model will be correct.
Mhm. Mhm.
But we are trying to actually project in a short run how the model is behaving.
Mhm.
So we are not just looking at the model, but we are also looking at the model of the model.
Mhm.
Okay,
Mhm.
so we are trying to look at how to do some sort of a meta model out of this.
Hey,
So
usually this graph kind of predicts some dates, or for that matter, range of the dates. How do you come to these exact dates for that matter?
yeah, so that's where the meta model comes in, and this is something that I have to show over here.
Aha. Okay.
Okay, so this is a
This graph definitely deserves more explanation. I can
yeah,
see
I'll explain.
8 minutes on both the axes.
Yeah, so you've probably never seen a graph like this before. So this is date versus date graph. So on the x-axis, if you see, are the dates, and they are the today's dates. Okay,
Mhm.
the y-axis is the date on which we are projecting something. Now, what is
Mhm.
it that we are projecting? So the blue line here, and I'll add more lines in a minute, but the blue line right now is showing when will we reach 30,000 cases in India by. Okay,
Okay.
so on, if I just wait for this to disappear, And if you sort of focus, so between 22nd and 29th March, okay,
Mhm.
the model was projecting, this one particular model was projecting that we will reach 30,000 cases between 10th and 17th of May. So somewhere over here. So that is what it was projecting. Okay.
Oh, okay.
By say 5th of April, which
Mhm.
is over here, the projection had become steeper, as we saw, right?
Mhm.
And by then they were projecting that we'll reach 30,000 cases by say 20th or 25th or 23rd, 24th of April. So the line had come down. That is when the tide started turning again, and the rate of growth started slowing again. So this line started moving up. Moving up is good. Okay.
True.
So we achieve this number when this blue line reaches the green line. That is when we achieve the number. So this is 22nd March on 22nd March, and this is 21st June on 21st June. So this is a straight line. When the blue line meets the green line, so we're trying to anticipate where will the blue line intersect the green line. And if you look at the recent trend,
Mhm.
okay, it might come in as soon as early as 27th of April, but it is possible that we can push it up all the way till 4th of May. So it looks like, I mean, if you look at it visually, it looks like it is going in that direction.
That's a kind of a range.
Right. So we kind of try to anticipate in which direction it is going in more recent times, and then try to go in that range. Okay. So that's the range that we are predicting. So in fact, if you look at our range for 30,000, it is between 27th of April
Mhm.
to about 4th of May, because that's the range that we're predicting over here. Okay.
Mhm.
Similarly, we have done for other. So this, by the way, we were doing earlier for 10,000 cases. Now we are past 10,000 cases, and you can see that the blue line that light blue line has met
Okay.
with the green line.
So
And
when
now we
the
are looking at
dark
how
line,
the 40,000 cases graph
hold
will
on,
look
let me
like.
just decode this graph again. So whenever the blue lines cut the green line, that is reality.
That is reality, that you have achieved that number, or
So
that you
the
have
predicted
reached that
and
number.
the reality kind of meet. That's where it hits.
Correct.
Okay.
So, and then how do we project? So we actually take, so the dark blue line that has come up now is a line which projects, which has shown the progression of the projection of 40,000 cases. When will India reach 40,000 cases? When might India reach 40,000 cases? And if you see, that line has been also wiggling around. It first went up, then it went down, and then now more recently it has started going up again. Okay. And so if you kind of project that forward, we are expecting that that might reach around 5th of May at the earliest, but it might go as far further out as maybe 15th of May or 14th of May, or
Oh,
around that.
oh,
Okay. So that's how we are saying between 5th of May to 14th of May, we will reach the 40,000 line.
okay.
And then similarly, if we do the orange line that has come up is 65,000.
Mhm.
Now the more further the line has to wiggle, the more unpredictable it becomes. So the range is going to be broader now. So we are saying this could happen as early as say maybe 17th of or 16th of May or 15th of May or around that time, and it can become as late as 21st of June. And if,
Okay.
because there is that is a huge margin. I mean, a lot can happen in that much time, so it might even go further then. It might be the case that we may never reach 65,000. And that is why our projection there is huge. It's from there to there all the way. So that whole range is like that.
Mhm. Mhm.
So that's how we did with the projections over here. And we did something similar for deaths. Okay.
Oh.
So in fact, deaths are more accurate measure than cases, because cases dependent on many factors, lockdown, and the strictness of lockdown, and implementation of lockdown, and the density of population. Like, are we talking about slums? Are we talking about rural areas? Are we talking about buildings?
Mhm.
And so on. But death has some sort of a finality associated with it. So therefore, actually, death seems to be actually lot more predictable. So how did we predict deaths? So
Mhm.
the light blue line again here is talking about 400 deaths by when. And if you remember, we just crossed that on 16th of April. Okay.
Mhm.
The dark blue line is talking about 1,000 deaths. We
Oh,
not yet crossed that, thankfully. If
okay.
you see, that line was more or less moving horizontally between, let us say, 5th of April till say 12th or 13th of April. It was more or less horizontal. But only after 13th or 14th of April, that line has started moving a little up. That means
Mhm.
the death rate has started slowing down. Only after that. One
Oh,
of the reasons why probably uh, the Times fact poll was not showing all of this was because their projection was based on data till 15th of April. And a lot has changed in 15th of April. Just in the last 4 or 5 days, actually a lot of good news has started coming in. Okay. So therefore, we are now projecting the deaths. We could reach 400 deaths, anything say around 27th April or so. But maybe we will be able to push that line up as further out as 10th of May. So that means, okay, actually that line can go up a little bit further over here also. Okay, so that's the range that we are looking at. That's the line of 2,000 deaths. So the 2,000 deaths seems to be steep, even a steeper line. And there is a possibility that this line may never meet the green line. If you look at only the recent trend, only after 12th of April. Of course, just like this trend changed, this trend can also change.
True.
But at the moment, it looks like it is going further and further, or at least parallel, it's moving parallel to the green line. So which means we may never reach, or we may reach much later.
If I just visually project the 2K line, doesn't seem to meet the green line.
Right. Absolutely. So if we were to make the most pessimistic projection, maybe we are saying towards the end of May, that line might come out and whatever. And yes, never. That's the other possibility. So that is why we are saying towards the end of May and maybe never from there. So maybe what will happen is this red line will go like this, and then it will kind of asymptotically move towards 2000. Okay. And then we did the same thing for the 4,000 deaths also, 4K line. Okay. So this orange line is showing about when we might achieve 4,000 deaths. And this definitely is moving away from the green line. Okay, in more recent times. The model has been projecting something, but the model has been projecting worse and like later and later. So, and that is moving faster than a number of days. So like in one day, that date moves ahead by 2 days. So hopefully that means we might never, of course there is fluctuation in that. So it comes up and down, but on an average, it seems to be moving, particularly after 12th of April. So a lot has improved since 12th of April. So probably the effect of the lockdown has started showing up after the 12th of April. Although the cases seem to be rising, the death rate is definitely slowing down. So that's how we project that we will never perhaps reach 4,000, and I'm willing to bet on that at the moment at least. Okay. Yeah, so that's the summary of it then. Is there anything else you want to talk
about? Generally, most of these linear graphs sounded very scary, and I believe people are talking about flattening the curve. Can you decode that word a little for us?
Yeah, people are using many words.
Some question was actually, in the media, we have heard a lot about doubling the cases, the rate of doubling the cases.
Yeah.
How relevant and important it is to measure that as a measure.
Yeah. It is important. So everything is important. So the advantage of using the word doubling the cases is people understand it very easily. Let us actually look at the doubling for a minute. So currently we have about 17,000 cases. So half of 17,000 is about 8,500. Okay. So if you see, so this is each of this light blue line is showing 2,000. So 8,500 is somewhere over here perhaps. So maybe around 11th of April. Okay. So we kind of doubled from 11th of April to 20th of April in about 11 days. Okay. Half of that is about 4,000. Okay. And that is probably over here. And that we doubled in about 6 or 7 days, and double of that. So that's whatever. So it's actually very difficult to make this out on a linear graph. That is why it is actually better to use what is called as a logarithmic graph. So this is a logarithmic graph. Now this graph, the x-axis is exactly the same, but the y-axis is different. So x-axis is same, the dates, but the y-axis, if you see here, it goes from 0, 20,000, 40,000, 60,000, 80,000. Here, it goes from 0 to 10, and then 10 to 100. So this is 10 times, and 100 to 1,000, and 1,000 to 10,000, and 10,000 to 1 lakh. So that's the growth of the y-axis. So it kind of compresses the upper numbers and expands the lower numbers. Okay. And this, so when this line looks like a straight line, then we are having a logarithmic growth. Okay. So we are doubling at a constant rate. But very recently, if you see, this line has started bending downwards. had it been a straight line, it would have reached here by the end of this week. By 26th, we would have reached 1 lakh number. Okay. But it is not, it is bending away from that. Okay, we are not yet, so this first line is 10,000, this second line is 20,000, which we are kind of approaching now. It will probably reach 20,000 in the next 2 days or 3 days or something like that. Okay. And then as we predicted, we'll probably reach 30,000 sometime next week. Now, hopefully the line bends more, and then it will be more visible as we go forward that the line has bent actually. So this is what is called as bending the line. In logarithmic terms, we talk about this line becoming bending over a period of time, and we are expecting it to bend like that, and that is our projection. And even the red dots, the orange dots of times factor are also predicting something. So I am predicting more of a bend than the times guys. The red dots seem to be a little higher than the blue lines, but we are all predicting that these lines will bend in the next 3-4 weeks. Okay.
Yeah, how are the fatalities looking on the logarithm?
Yeah. So in fact, the fatality are looking in fact much nicer. As I said, the blue line could be also rising because of the number of testing becoming more systematic, and we are doing things better. But here is the fatality line on the, so this is the fatality line on the linear scale, where this goes from 0 to 2,500, and we are saying maybe we will go asymptotically towards 2,000, so which means we will not cross 2,000 anytime soon. Okay. And there is actually also a slight visible bend of the curve over here in this part after 12th of April. But that is a lot more pronounced when you look at it on a log scale. So just look at the bend over here. Okay, it's a lot more pronounced here than it was over here. Okay. And so we are expecting that actually we will probably reach 1,000 sometime late next week, or even beyond that, maybe the week after. And hopefully we will not reach 2,000. So this is the projected line that we are looking at in terms of deaths in India. So the doubling rate remains constant if this line remains straight, but the doubling rate is going down. We will eventually double. Even in a linear system, we will double. But in a linear system, the logarithmic graph will not rise as fast. So this has been a very fast rise. So we went from 1 case to 10 cases in about 2 weeks, from 10 cases to 100 cases in another 2 weeks. And from 100 cases, we might reach 1,000 cases. Actually, now we have started slowing down. So we reached about, from 100 cases to 200, we reached in a matter of days. 200 to 400, we reached in a matter of 6 or 7 days. But now it is slowing down. Last 4 or 5 days, we have slowed down, and we might slow down further as we go. So that's the good news.
Oh, wow. So it's always better to end on a relatively good note. Hey, by the way, just a thought. Do you want to do global numbers next time in another video?
Maybe we could do that.
And now, do you really want to think about introducing ourselves better?
Well, if they watch the video till here, maybe they already know us. So let us stop over here, I think.
Hey, that was a nice story told by the data. I really love the way you told the story, by the way. Thank you very much for watching this video. Thank you.
And thank you for asking all these questions and taking this initiative. I decided to do this only because of you. So thank you very much. Bye.
Bye-bye.